Good afternoon. Joining me are Lieutenant Governor Boyd Rutherford, House Speaker Adrian Jones, Senate President Bill Ferguson, Maryland State Superintendent of Schools Karen Salmon, Deputy Health Secretary Fran Phillips, Major General Tim Gowan, who's the Adjutant General of the Maryland National Guard, Dr. Mohan Santha, the CEO of the University of Maryland Medical System, Kevin Sowers, the President of Johns Hopkins Medical Health System, as well as several members of our Maryland Coronavirus Response Team, Dr. William Chen from the University of Maryland, Baltimore, Dr. David Marcosi from the University of Maryland School of Medicine, and Steve Evans, the Executive Vice President of MedStar Health. Earlier today, we confirmed the first case of community transmission of COVID-19 here in Maryland. The individual is a Prince George's County resident who is currently hospitalized. Unlike Maryland's previous cases, this person had no known exposure to the coronavirus through travel or through another known infected individual. The circumstances of this case indicate that we are entering a new phase of this crisis in our state. We should expect the number of cases to dramatically and rapidly rise. Our primary focus is now turning from containment to aggressively working to mitigate and limit the spread of the virus. Just yesterday, the World Health Organization declared the coronavirus outbreak to be a global pandemic. More and more countries and states here in America are struggling to grapple with this crisis. I want to again assure Marylanders that all levels of government have been preparing for this for many weeks. But we have moved into community transmission in our state, and we believe that all of us need to take serious actions to limit day-to-day interactions and activities. And we all need to do our part to stop this virus from spreading. This afternoon, I met with the leaders of the General Assembly, Speaker Jones and President Ferguson. And a few moments ago, we had another emergency meeting of my full cabinet. At the advice of our entire leadership team and our coronavirus response team, we have made the decisions to take the following major actions in order to protect public health and safety. Effective immediately, I just directed the Maryland Emergency Management Agency to move to its highest activation level in order to mobilize all available state resources to respond to this threat and fully coordinate response resources with county and local officials. I have just enacted an executive order to activate the National Guard and move the Guard to a higher state of readiness in order to carry out any necessary functions and critical areas of need in the coming weeks. Also effective immediately, all state government is raised to elevated level 2. Effective immediately, all non-essential state employees who are approved for telework will be required to telework. Until further notice, public access to state buildings, including the State House, will be restricted. I have enacted an executive order prohibiting any social, community, religious, recreational, or sports gatherings or events of more than 250 people in close proximity at all locations and venues across the state. All planned large gatherings and events must be canceled or postponed. All senior activity centers will be closed until Maryland is no longer operating under a state of emergency. All state and local government buildings and facilities with an expected occupancy or attendance of more than 250 people must communicate the recommendations of the Maryland Department of Health regarding social distancing and provide all occupants and attendees with the capability to wash their hands. I have signed an executive order to close the cruise ship terminal at the Port of Baltimore until further notice. No passenger or crew member will be allowed to disembark at any terminal at the Port of Baltimore from any passenger vessel that has made a call at a port outside of the United States. The only exceptions to this order are 2 ships, which are currently due to return to the port in the coming days, and which will have to follow all appropriate screening protocols. I have enacted an executive order allowing for the extension of all expiration dates for all licenses, permits, certifications, and other authorizations that are issued by any agency of the state of Maryland, including driver's licenses, vehicle registrations, professional licenses, and so forth, until the 30th day after the date that the state of emergency in Maryland ends. As I have repeatedly said, older people, and especially those with underlying health conditions, are more vulnerable and at significantly higher risk of contracting the disease. We are directing all hospitals across the state to immediately adopt new visitor policies to limit the spread of COVID-19, including allowing only 1 adult visitor per patient, prohibiting visitors under the age of 18, screening visitors for flu-like symptoms, and prohibiting visitors with recent international travel. Effective today, all Maryland state prisons will suspend visits in order to protect employees, inmates, detainees, and their families, while our state continues to operate under the state of the emergency. I'm also delegating the day-to-day operations of all non-essential, non-crisis related functions of state government to Lieutenant Governor Boyd Rutherford, so that I can focus my full attention on managing this crisis. 2 weeks ago today, at the Maryland Emergency Management Agency, I spoke about the fact that we could expect this virus to cause major disruption in our lives. And just 1 week ago today, I announced our first positive case. As I warned and have repeatedly stressed, this problem is going to continue to escalate and evolve rapidly and dramatically. For Marylanders, the actions that I have announced here today will be disruptive to your everyday lives. And they may sound extreme, and they may sound frightening, but they could be the difference in saving lives and helping keep people safe. They do not mean, however, that daily life as we know it should come to a halt. Those businesses that are essential to society and community, including grocery stores and gas stations and restaurants, should remain open. As I've also been saying for weeks, information is changing not only on a daily basis, but on an hourly, almost minute-by-minute basis. And it's impossible at this time to know how long this threat will continue. What I do know is that my first and highest priority is protecting the health, the safety, and the welfare of the people of Maryland. I also can tell you that we have the best team of people working around the clock to address this crisis. We will continue to keep you informed, and we will continue to do whatever is necessary to help keep people safe. And I just want to speak to the people of Maryland directly by saying that we are all in this together, and we cannot stop the spread of this virus without each and every one of you doing your part. But I also want all of you to know that we will get through this together, and that our state has already faced and overcome daunting challenges before, and we will do so again. At this time, I'm going to turn the podium over to Dr. Karen Salmon, who's the Superintendent of the Maryland State Department of Education, to make major announcements regarding the Maryland Public Schools.
Thank you, Governor. At this time, I am directing that effective Monday, March 16th through Friday, March 27th, all public schools in Maryland will be closed. All scheduled school-sanctioned travel for students and staff will also be canceled effective immediately. It is crucial that we take immediate measures to slow the spread of COVID-19 in school communities around the state. During the time of school closure, all public school buildings and school buses will be cleaned and disinfected to prevent the spread of the virus upon the return of students and staff to school. Additionally, I am recommending that days previously scheduled for spring break be used for makeup days of the school closure. Administrators, faculty, staff, and parents and guardians should begin to immediately prepare for and to put into place measures for the continuity of educational services during a prolonged period of school closure. Plans regarding child care services are being developed by the State Department of Education at this time to ensure that the Children of Emergency Services personnel, particularly those who are working in our health care facilities, will have access to child care through a prolonged period of school closure. We have started to work immediately to ensure that vital services, such as the provision of meals to students, will continue to be provided throughout the duration of this school closure period. Incoming information will be continually evaluated as it becomes available to better inform our decisions about proactive school closures. Schools and state officials will continue to work together to continue to reassess this situation. Local school officials should remain in consistent communication with local health departments regarding the COVID-19. At 5 o'clock today, I will be speaking to all 24 local school systems superintendents to work on plans, resources, and supports that we'll be using during this closure. And now I'd like to introduce Fran Phillips, Deputy Secretary of the Public School Services for the Maryland Department of Health.
Thank you, Dr. Salmon, and thank you, Governor. We are encountering now a public health crisis, and it is one that the citizens of Maryland can be assured by the demonstration here that the response to this crisis, this public health crisis, is one that has engaged all sectors of our state government, of our local governments, and certainly our partners, our healthcare providing partners as well as business partners. This is a public health emergency, and it is one that has a coordinated response, as you will hear, as is demonstrated here today. These are extraordinary measures that you have heard announced today, and this is an extraordinary time. These are measures that have been undertaken with a great deal of consideration and with a great deal of evidence. These are measures that are meant to protect Marylanders. These are measures that are taken for 3 goals. The first goal is to slow the spread of this infection. It is very important now that we have evidence here in Maryland of community transmission that we take the steps needed to separate people sufficiently that we can slow down the person-to-person transmission. And that's important because we do not want many, many Marylanders to become sick and need help and care at the same time. Goal number 2 is to protect the vulnerable people. And as you've heard from the governor, we have enacted directives with regard to long-term care facilities, particularly looking at individuals who are 60 years old, 70-year-olds, 80 years old. These are particularly vulnerable people, and we want to protect them in our community. Likewise, people with underlying medical conditions. Very, very important that we protect those people. But the third goal is to maintain essential services. So as you heard the superintendent say, while the school closure may be disruptive, there will be measures taken to assure that essential workers, including healthcare workers, have the opportunity to have child care so they too can contribute to this very, very important mission. And that is a mission to protect the health and safety of all Marylanders. In a minute, I will introduce 2 physicians who have been tremendous contributors to the governor's advisory committee on the response to this COVID outbreak. We're very, very fortunate here in Maryland to have the leadership, the expertise, and these world-renowned organizations, healthcare organizations in our state. It's an incredible asset in a moment like this. Before I introduce the speakers, though, I'd like to take a minute and mention our cases, the individual Marylanders to date, 12 of them, who have been confirmed with the COVID-19 disease. Of those 12, 2 continue to be hospitalized, but I'd like to say that I'm happy to say that 3 of those now have fully recovered and have passed their quarantine stage, so that this is evidence that this is a disease that can be properly managed. It's a disease that is very, very serious, and that as a community we will take very, very extraordinary measures. But again, these 12 individuals, I would like to reach out and to thank them and their families for the extraordinary cooperation that they have given us in the public health community by being open with us as far as their histories, their travel histories, their medical conditions. Very, very important, as they were pioneers as we understood as this infection first arrived here in Maryland. That's a public service that we are grateful for, and I know that we are grateful for the future contributions of Marylanders across the state as we adapt to these new and somewhat disruptive measures. So with that, I'd like to first introduce Dr. David Marcosi. Dr. Marcosi is the Associate Chair of Population Health, and he is the lead in emergency medicine with regard to University of Maryland Medical System. Dr. Marcosi.
Good afternoon, Governor, distinguished guests, fellow Marylanders. This is a challenging time for our state. I am the Incident Commander for the University of Maryland Medical System, and we wholeheartedly endorse the bold and decisive decisions of our governor here today. This is not about a healthcare system. This is about all of us. We can all fight back against this virus, and in fact, we need to. The healthcare system can treat those who are ill, and across all of Maryland, we are readying ourselves in case we need to. However, by putting aggressive steps in place that the governor just outlined with regard to social distancing, closures of schools, teleworking, these are steps we can all adopt, not just the public sector, but I would also encourage the private sector to adopt the same types of measures that Governor Hogan just laid out. Why? Because the earlier we do this, the more layers we put in place, the less this virus can be transmitted. That's the key. Stop the spread of the virus so that it doesn't affect our young or our elderly. Because if this virus looks and appears to be affecting our elderly more significantly, and then our healthcare system will respond. But if we put these steps in place early enough, we can dampen down, we can flatten that curve, which is what we need to do so that our healthcare system can respond appropriately to the patients who do become ill from this virus. So Governor Hogan, we stand with you, and we look forward to working with you and our state partners for this response.
And I'd like to invite Dr. Stephen Evans, Executive Vice President and Chief Medical Officer at MedStar Health. Dr. Evans.
Good afternoon, ladies and gentlemen, Governor Hogan, distinguished guests. Governor, thank you for these bold moves. This is exactly what the residents of the state of Maryland need to protect themselves. I'd like to comment about 2 major initiatives that are ongoing in our hospitals and healthcare systems around the state of Maryland. First and foremost, we are working collaboratively and closely together to develop pathways that allows for the increasing number of Marylanders who are seeking care to make sure they don't have COVID-19. These pathways, these models and triages of care have been shared across the state that include any Marylander coming in to determine who should we test, who should go to an emergency room, what are the criteria for admission to a hospital in our state, thinking that we now have sets and standards that we could apply for any of those patients. Additionally, we're thinking through how do we manage the increasing number. We certainly simply can't rely upon our emergency rooms across the state to manage this kind of volume. We think through our urgent care sites, our physician offices, and creative models using telehealth and telephonic methodology to actually determine on the phone or through telehealth platforms, does a patient meet criteria for testing, or even in a more severely ill case, visit to the emergency room and considering admission. Secondly, and equally as importantly, is keeping our healthcare workers safe. Governor, thank you for actually putting in a standardized process across the state around minimizing the number of visitors who come to see our patients. This is not easy for Marylanders. If you have someone sick and ill in a hospital, and reducing that and all the family members is tough to do. But Marylanders, we are a tough group, and these are very, very difficult times. And so we must keep all of our healthcare workers safe so that they're able to take care of all of our patients. As we think through this, this is a very fluid and volatile time. Our models of care, inpatient as well, are being shared about how we do this in the best and most effective way to maintain and manage our resources in a cost-efficient and effective fashion so that, in fact, we can think about larger increases because we know that there will be increases in the numbers of these patients. We're also looking at modeling going forward, looking at other countries in terms of what happens and preparing ourselves so that we can care for every Marylander if necessary. Again, Governor, thank you very much for your leadership in keeping all of our Marylanders safe and our healthcare workers safe.
All right. Well, thank you very much. I think just the last thing I want to say about this great group behind us is, we have some of the best medical facilities and some of the smartest scientists and doctors in the world, and we're very lucky that they're all working together on this team, and I want to thank them all for their cooperation and for their service. I'll be happy to take some questions.
Governor, how are you going to utilize the media such as us? Are we going to be able to come to rooms like this to put out your message?
Well, that's a great question. We're certainly hopeful that we don't have a room like this again with this many people, because we're going to be limiting the crowds, but we're going to make sure that we have access to you, because the media is critically important to get the message out so that we can reach the folks across the state. I think we'll limit the number of other folks that attend the press conferences, maybe not such a big crowd up here. These guys telling us social distancing, look how close they are together. And maybe not so many people in the room, but we're going to make sure that the media is able to get we're going to continue to update people with as much information as possible, because as we said, all Marylanders are in this together, and you are actually a part of that to help us get the message out to the people all across the state.
Governor, a question for the presiding officers. What effect do these executive orders have on the current operations of the General Assembly?
Since the beginning, we've been working with the executive branch hand in hand. Immediately following this press briefing, the Speaker and I both will be meeting with our respective leadership teams, members of the majority party, the minority party, to ensure that the legislature can continue to uphold its constitutional duties, but doing it in a way that is safe and is protecting public health. We will have an update later this afternoon with steps that the General Assembly will be considering and putting in place in order to deal with this public health crisis.
Is it likely that the General Assembly may adjourn or recess earlier than the 90-day deadline?
We'll have an updated statement in the next couple of hours with steps that the General Assembly will take.
Governor, I have a question about the upcoming Maryland primary. A lot of concerns among election judges. Have you been contacted by elections officials?
So yesterday we were contacted by elections officials about some concerns they had about the upcoming primary. The question came up yesterday. We just briefly, right before we came out here for this press conference, had a very quick conversation with the presiding officers about that. It's just an issue that we pushed off from today because of all these other decisions, but it is something we're concerned about and will be addressing in the coming days, but it was not one of the decisions we made today.
Governor, nationally, there's been a question about the availability of testing. Where are we with that?
Well, that is still continuing to be a concern. I'm not sure if one of the doctors or a friend would like to address it, but I know that they are trying to ramp up production nationwide, and we've now got some private facilities with Quest and LabCorp that are but this is an issue, and it will continue to be an issue as the demand for tests continues to grow and the lack of tests are out there. It's at this point in time, those decisions have not been made. We've announced all the steps that we are taking, but let's just say that all the transportation folks are doing the same kinds of planning that all the other groups are and looking at every contingency and possibility.
Governor, is there a sense of how many people have been tested at this point and what the results of those tests are? Are there any pending
I'll let Fran get, I don't know if we want to get into the specifics every day about how many, because it's going to be hard to keep track of, but we have 12 positive tests. There are a number of pending tests that'll change on an hourly basis. We've updated you every time we get a positive test. The number of how many have tested negative is just growing as we sit here, so it's hard to keep track of.
Is there a recommendation on non-public schools?
We'd love to talk with you afterwards. I think we're going to make the same kinds of suggestions. Obviously, these are decisions you make, but the superintendent of public schools made a decision based on all of the best evidence and advice from the health department and from all of these smart doctors. And my advice would be that the private schools should consider following the leadership and the guidance of the public schools.
Governor, not many states have taken the step of closing schools statewide for 2 full weeks. Why is that something Maryland chose to do now? And related, are you doing this of your own initiative, or is this guidance coming from the federal government?
Actually, this was a decision by the state superintendent of schools who called us this morning saying that she had made this determination. She has the authority. She works for the State Board of Education. She's not appointed by me or doesn't serve at my pleasure. But we brought it up to the entire team of doctors and our entire management team of state government, and they unanimously agreed with her decision. State of Ohio did it right before I walked out the door here. And I believe other states will be taking the same actions. We'd rather be out at the forefront of making decisions quickly rather than be at the last one to make it happen. These doctors were telling us that not taking actions and pushing things off till next week, it would be a critical mistake. Anybody else?
Governor, how are you going to utilize the National Guard?
That hasn't been determined exactly. It's based on the need that we're going to have. We activated the Guard under the state of emergency so that the general can put them on notice. It takes they've got to have their bags packed. They've got to tell their jobs that they may be leaving town, and they're going to be ready based on what units we need, which ones are going to be called. We're not activating the entire National Guard, but they have multiple capabilities based on what our needs are in what parts of the state. They've got a medical capability. They've got, they're great at transport and whatever our needs are. If somebody says this county needs this through the Department, Maryland Emergency Management Agency, the general will say, call up the folks he needs for that particular mission. And they can, the readiness is within 12 hours, they'll be on the streets.
What about child care centers? Is there advice to daycare centers and the like?
The executive order, I'm not sure, I think the executive order is about child care centers. There are some directives about they ought to be taking some of the similar steps that the schools are taking. Those are issues that we're dealing with. Obviously, that's going to cause a tremendous hardship. But senior activity centers are closing, and daycares probably are going to be an issue as well.
Thank you.
Thank you.